Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us once again. You know, protecting our skin from the sun should be top of mind, especially this time of year. But there's a new survey out by the Skin Cancer Foundation that reveals that most Americans aren't aware of a potentially life-threatening skin cancer known as CSCC. Here to talk about this skin cancer is Dr. Ariel Ostad and Ron Maniloff. They're both joining us to talk about why skin cancer awareness is so important. Welcome to the program, both Dr. Ostad and Ron.
Thank you. Thank you, Neil.
Right. Dr. Ostad, what is CSCC and how common is it?
CSCC stands for Cutaneous Squamous Cell Carcinoma, otherwise squamous cell carcinoma of the skin. It is the second most common type of skin cancer. Approximately 1 million cases are diagnosed in the U.S. each year. And this type of cancer occurs more often than a combination of lung, prostate, and breast cancer combined.
Wow. Ron, you were diagnosed with this type of cancer. Were you aware of it? I said, you know, most Americans aren't aware. Did you know anything about this? Had you ever heard of it?
Not specifically in this particular diagnosis. I mean, I've been treating cancer patient, unfortunately, Neil, for over 30 years. I'm 65 now, and I present all the risk factors normally associated for CSCC, over 65, fair-skinned, and I live in southern Florida. And while I've been a skin cancer patient for over 30 years, I suffered from advanced CSCC this past October, developed very large, severe cancers on my scalp that came upon so quickly. It was scary, because then for the first time I found out a non-melanoma type of cancer, this one, can equally be life-threatening.
Is this typical, doctor?
So Ron's case is not the most typical. Majority of squamous cell carcinomas are treated and diagnosed early, where they're smaller. Majority of squamous cell carcinomas can be treated early with surgery. However, if squamous cell carcinoma becomes larger and it progresses, radiation and in some cases systemic therapy may be considered. But Ron's case is unfortunately not as common. So
is there anything that can be done to keep a case such as Ron's from progressing, or is it something that is just depending on the patient?
No, many things can be done. So foremost, prevention is critical. So it's important we basically do the best we can to stay out of the sun, use our sunscreen, avoid sun exposure during the middle of the day between the hours of, let's say, 11 to 5, wear our hats, protect our skin with sun, SPF type of clothing. So prevention is key. And then the other essential component is to, catch the squamous cell carcinoma early on, where it can be easily treatable. So early detection leads to a cure. So early detection is important. And that means that if you suspect that something is on your skin and it appears as a bump and it's not going away and it's growing and it becomes scaly, rough, can all of a sudden spontaneously bleed, it is important to see a dermatologist for a biopsy to catch squamous cell carcinoma early on, where it's easily treatable.
You know, Ron, I heard you mention that you found out that a non-melanoma type of cancer, could turn into, a condition such as yours. What is it that you want to tell other people about protecting themselves from the skin cancer awareness? Some of the things that maybe you believed that you now understand aren't quite true.
Limit your exposure to the sun. Obviously, sunscreen. We all know that. Wear a hat more often, especially if you fall into the risk category of being fair-skinned, as I was. And clearly, if you live in more of the southern regions or the West Coast, where you have a greater likelihood to be exposed to the sun with greater intensity, just be more mindful. The survey told us that this type of skin cancer can kill more than any other cancers that we would ordinarily associate with fatality. it's more prevalent than what we thought, according to the survey, Doctor, correct? And unfortunately, I found out in a very personal way of the onerous nature of the disease, how quickly it can come on. But I'm happy to say, because I was under good care and proactive in my own health, that I was able to be a cancer survivor rather than a cancer casualty.
Dr. Ostad, as a dermatologist, were there any results of the survey that frankly surprised you, or did you expect some of the results as someone who's dealt with in dermatology for as long as you have?
So the results of the survey actually did surprise me. I'd like to share with you those results. So of course, this survey was actually conducted by the Harris Poll on behalf of the Skin Cancer Foundation in coordination with Regeneron and Sanofi. What was surprising about the results of the survey was, number one, that about 3 out of 4 Americans are not familiar with squamous cell carcinoma of the skin, otherwise known as CSCC. More than half of Americans incorrectly think that melanoma is the most common, but CSCC is actually diagnosed 5 times more often. And lastly, only about 1 out of 4 Americans know that squamous cell carcinoma of the skin can be life-threatening when advanced. These things did surprise me.
Were there any things that you found out that people believed other than what you just explained, as far as using certain types of sunscreen, certain types of clothing, things that maybe should be discarded or not believed anymore as a result of the survey?
I think what still holds true is that unfortunately most people are not really diligent and disciplined about staying out of the sun properly, as disciplined and diligent about using sunscreen. So the advice I would give to your listeners is basically stay out of the sun as much as you can, truly avoid the midday sun, try to go out and enjoy yourself early in the morning or the latter part of the day. Try to wear a hat, try to wear your sunscreen, reapply your sunscreen, make sure your SPF is at least SPF 30 and has what we call broad spectrum coverage against UVB and UVA. So prevention is critical. And then lastly, again, if you see, and examine yourself, get into the habit of examining yourself once every quarter. And if you see that there's a lesion that's changing, trust your instincts, go to your doctor. It's always best to catch these things early where they're easily treatable. It's only when, unfortunately, they're diagnosed late where problems arise.
Do you think maybe awareness of CSCC and skin cancer as it relates to sun exposure should be a conversation that's kind of just as common as, do you want a flu shot?
I absolutely believe so, because unfortunately, to this day, there's still about 15,000 people who die of advanced squamous cell carcinoma of the skin annually. And so I firmly believe, and that's just squamous cell carcinoma of the skin, so I firmly believe that it's important to protect people, especially our youth, because that's where a majority of sun exposure happens. So it's important to educate. Knowledge is power. So I think it's so important to have these conversations about letting people know about the dangers of the sun and what it can lead to.
Right. Thank you both for joining us here on the program this morning. It's been a pleasure and very informative, both Dr. Ostad and Ron. Where can our listeners get some more information about CSCC and prevention of sun exposure?
So your listeners can visit the website skincancer.org/CSCC survey for further information. There's a lot of great information. And again, knowledge is power, so I encourage you to learn more about this disease and skin cancer.
Again, thank you both for joining us here on the program.
Thank you, Neil.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our YouTube channel at youtube.com.